Hey guys, Dr. Nick Araza. I'm not only a chiropractor, but also a dad. And what that means is I carry kids around. I carry them often. I not only see them in the practice, but I see them every day at home. I got 3 of them. And my youngest son, Dane, is a beefcake. He's huge. He's 4 to 5 months almost. He's weighing in about 22, 23 pounds. He's just big. Okay, so as you know, as a parent, if you're watching this, because we had that in one of the tags there, is basically we have to carry these 20-pound medicine balls. Babies, they're floppy, they're flimsy. We got to carry them, and we got to carry them for long periods of time. Some of you moms, some of you dads out there, you know, we're talking about all day. There's periods when we know our kids get clingy, right? And they don't want to be put down, so you're holding them, you know, you're just holding them, and you're holding them and holding them. And we can even resist that with good posture. You can check out some of our things on how to lift a baby, how to hold a baby. But those postural muscles get tired, right? And we end up starting to sag into our spinal joints. And if you're doing that, you can start to feel pressure. You can start to feel discomfort through your lower back, through your middle back. It'll really just start to be sore. Depending on how far along you are in the damage of your spine process, you can help to mitigate that with some stretches, some gentle stretches, all the way to, you know, extensive chiropractic care, and on the worst case scenario, we can have, you know, surgery that might be required if the damage goes on too long, or down the road if we've never dealt with this. So you want to work on this sooner than later. I want to show you guys a very intense stretch that I want you to just try out gently. I do this usually when I'm holding my son. I do it at least once or twice a day if I have to hold my kids for a long period of time. My daughter also likes to be held a lot right now. She's about 2. So what we'll do here to basically counterbalance all this holding here, is that we're going to use a lever here in this area that's soft, like a pillow, a couch, something like that. And then we're going to stretch over that. Now, if you feel any sharp pain, stop immediately. If it doesn't feel therapeutic, stop immediately. If you've got, you know, underlying disc issues, underlying, you know, pathologies in your spine, this is something that could be, you might not want to do this. So you want to just ease into it, try it out. If it's not working, consult a healthcare professional, okay? But what I do here is I keep my spine nice and tight, okay? I slide down to about halfway through my spine, so midway right there, and then I just lower my hips a couple of inches. There we go. And then I also reach up overhead, and I just try to relax into that. Okay, so I'm not forcing anything, I'm just kind of relaxing, and I'm elongating. I'm translating my torso anterior, because that's the opposite of holding kids, is that. So, and it just feels real good. Okay, a lot of times I'll hear some release, little clicks and pops that might happen through there. And I just hang out here for really only about a minute. Okay, I might stretch up overhand, but just take it easy, because this if you're really rigid, if you haven't ever done this, you might go to here and you might be like, whoa, this is a lot, okay? Foam rollers are also good for this motion, but again, you want to ease into it. Treat it very softly, very gingerly. You can always add, but you cannot take away. Okay, so just hang out there for maybe your first time, even like 30 seconds, 15 seconds. And then when you come out of it, you want to come to the side, not straight up, okay? And you will noticeably feel an elongation through your torso. So that's one of my favorite kid decompression stretches at home, using my couch here. I've used stairwells, things like that, but you just be nice to yourself, use some padding, make sure you just start off nice and easy on that. Hold it for 20 seconds, a minute, something like that. Okay, that's it. I hope it helps.